Hi, my name is Robert Chelle with Chelle Law, and I'm an attorney that assists physician assistants with employment contract and independent contractor agreement issues. Today I'm going to talk about physician assistant independent contractor agreements. So what are the differences between being an employee versus an independent contractor, and then also some red flag areas some language that absolutely needs to be either absent or inserted in an independent contractor agreement if you're a PA. All right, so first, what are the main differences? Well, if you're an employee, you'll receive a W-2 at the end of the year. Taxes will be taken out of any of the compensation that you receive. Normally you'd get benefits, so health, vision, dental, disability, life, retirement. They'll pay for your PA license with the state you're in, DEA registration, normally your malpractice. Maybe you're not, they'll pay for your tail if you have a claims made policy. But as an employee, you generally just get much more benefits than if you're an independent contractor. Now, if you are an independent contractor, you'll receive a 1099 at the end of the year, but no taxes will be taken out of your compensation. You'll be responsible for paying all of those things. And then, as I said before, normally you will be the one that's covering the cost of, basically everything associated with your practice. So, like, the only thing that some organizations will cover if you're a independent contractor would be your malpractice insurance, but most of the time they're not going to pay for anything else. Now, the danger of working as an independent contractor is being misclassified. And so let me explain what that is. The IRS has a 20-factor test that kind of goes through whether, if you meet this factor, then you might be an employee, whereas if you meet these factors, you might be an independent contractor. And it would be like control. So are they telling you where to work, when to work, the patients to see, providing you with office, staffing, admin, access to the EMR? Basically they're dictating the entire employment relationship and what to do, and when you're there, the comp structure, all that kind of stuff. They have absolute complete control over you, then maybe you're not an actual independent contractor. Now, an independent contractor agreement does make sense if you're like very part-time, meaning maybe once a week, a few times a month. But if you're working full-time for an employer, it's probably unlikely that you're being classified correctly if you're classified as an independent contractor. Now, what are the dangers associated with being misclassified? Well, the state or the IRS could come in, look at the contract, look at the employment relationship, and then reclassify the PA as an employee. In that scenario, there'll be some fees, penalties, back taxes that have to be paid. So the PA needs to make absolutely certain that there's not language in the contract that states if a governmental entity comes in and decides to reclassify the PA from an independent contractor into an employee, that the PA is going to be personally responsible for all those fees, penalties, costs, back taxes. 99 times out of 100, it's the organization dictating whether you're going to work as an employee or an independent contractor. And so if they're the one telling you this is what we are classifying you as, you shouldn't be responsible for all of the penalties associated with reclassification. So there needs to be language, and it almost needs to be opposite of what I just said, that says the organization is going to be the one that's responsible for all those fees and cost penalties if the PA is reclassified. So that's probably the main thing to take away from this video, is make absolutely certain that there's no language that puts the onus on the PA in the event there is some kind of misclassification. Another thing would be compensation. Normally you're not going to get some kind of like base salary. It would be either hourly, shift, per shift amount, or even a percentage of the collections received. You're going to be working infrequently enough that kind of a straight base salary doesn't make a ton of sense. Certainly you're probably not going to get any paid time off or anything like that. So in a scenario like that, it'll be makes much more sense as an hourly or per shift compensation structure. Last thing, as far as malpractice goes, normally it would be on the PA if they are a 1099 independent contractor to get their own insurance. And so you have the opportunity to kind of decide, do you want an occurrence policy? Do you want a claims made policy where you have to pay tail insurance? I would suggest getting an occurrence policy. It saves a lot of headache for the PA. It is about a third more expensive per year than claims made coverage, but you don't have to pay for tail, which can be, for a PA, it's not like prohibitively expensive, but still it's going to be thousands of dollars that you'll have to pay if you have to pick up tail insurance for an organization. So you want to make certain that you are obviously have all of the coverage. And as I said before, sometimes the organization will pay for your malpractice. And perhaps they'll cover your annual premium as a claims made policy, but then you'd have to pay tail when you leave. So those are just some things to think about if you're about to sign an independent contractor agreement as a physician assistant. If you have any questions about an independent contractor agreement or an employment agreement, feel free to contact my law firm. Our information is listed below in the description, and I appreciate you watching the video. All right, thanks. Take care.